Welcome to the program. Today, we are going to take the topic of healthcare and we're going to take it from a slightly different direction. So, a couple of episodes ago, we talked to Allison Crossweight on alternative medicine, is what we called it, even though that is a blanket term that covers basically anything that's not part of the formal scientific literature with evidence based, lab tested, real world, rigorously peer reviewed science, right? And that's a whole bunch of stuff, including the old like chicken soup for a cold. Works for some people, but maybe not a ton of science behind it. All the way through to talk therapy, and where there's a benefit to that over and above the traditional psychotherapy that is licensed today. And we got into some other topics of even breathing exercises and movement. So, if that was a primer for the overall topic of alternative health, I thought it was important that we bring on additional guests to talk about this trend in the technology sense. Where can technology help in making alternative medicine, alternative treatments, alternative therapies accessible to people, and alternatives that can be complementary to the traditional healthcare system. And this is harder to find than you might think. If you've done any research on this, it feels like the traditional medicine space is full of people in white coats and medical degrees in one camp and everybody else in another camp. And these are not complementary to each other to the degree that practitioners of alternative healing don't even bother trying to go through any sort of an FDA approval process for those in the US. Our Food and Drug Administration has a rigorous process to approve treatments or therapeutics, even those that are not ingested through pills or through liquids or through injectables. We have a rigorous process in the United States, and much of the European Union, all the European Union has the same or similar standards. And then, of course, there are regulatory bodies around the world. So it feels like these two camps live in different worlds. Well, Grace McNamara is somebody that we found who is in both. This conversation that we're going to have today, I think, is very interesting because, in one sense, we're talking about a simple application of an app on your phone, something that you can download today without any guidance or any assistance of any kind. And it might work very well for you to set up an exercise program that's custom to you and that encourages movement and incentivizes that movement. And I'll let Grace obviously talk about her own application and how she came to it. But what I think is really important about the general trajectory of the show today is that she went the extra mile to not just develop an app and release it in the App Store, but to seek basic FDA approval to effectively endorse this application and the use of it and the tailoring of it and the benefits for exercise as a general practice, movement in general, routine exercises that can get your heart rate up and get you out of your house and or have you move around in your house, but with actual regulatory approval so that a doctor's office, primary care in all likelihood, could actually prescribe you this application. And with nominal or no cost, you can begin a exercise routine that could be incentivized for you personally and monitored by your physician to ensure that you're sticking to it and getting the benefits of it. It is the marriage of the traditional space where you go and visit your primary care doctor with technology-driven alternative medicine, which isn't medicine at all. Is exercise really medicine? No, it's a lifestyle. It's something that you do. It's something many people do as part of their normal routine. But when used as a treatment for underlying medical conditions to help improve them without the intervention of pharmaceuticals or any sort of drug or any sort of surgery or major medical intervention. And by the way, it costs nothing to exercise. And if there's a nominal cost involved to some sort of an app, if you want to use it in that way, maybe this is something that someday can be picked up by insurance companies or governments that would be willing to fund. Now that's more of a business model conversation, and we get into a little bit of that with Grace in this interview. But I hope that you enjoy this program. And I also think Grace was a fascinating person to speak to, not only because of her thought process around developing this application and her commitment and passion for how so routine and simple lifestyle changes can make people healthier with all kinds of ailments that they're dealing with, but also what it took as an entrepreneur to take a great idea and make it into a real business, and how she was able to go through that process. So, even if you're only listening to this program to get some inspiration for an entrepreneurial idea that you may have or somebody that you know may have, I think there's a lot to get out of this program. I certainly enjoyed this interview. Grace was a great guest, so articulate in the way she speaks about the challenges, the product that she brought forward to address those, the rigorous approval process that she has gone through to make this a more mainstream and accessible solution, and then her journey as a professional, as an entrepreneur, as the leader of a business. She is the CEO of a company that, you know, was her brainchild, and it is her passion, but at the same time, it's a business and she has to run it like a business. The name of the business, by the way, Exercise Intelligence. We have a link to it in the description of this podcast. We'll certainly have links to it on our social media channels and the website as well. But you are about to talk to an entrepreneur, a CEO, a passionate advocate for healthcare, and somebody who has some good advice. Advice for entrepreneurs, as well as advice for those of us maybe managing chronic conditions. Maybe if your blood pressure is a little high. Maybe if you just don't understand how this app would be different from any other, you know, medical or weight loss app that you've downloaded before. I think it's going to be a good use of the next roughly hour of your time. We the interview ran about 45 minutes, but we carried on a little bit beyond that just to talk about some of the nuances of Grace's background and how she was able to develop this great company. So I look forward to getting feedback from you all on this program. But without any further delay, I present to you my conversation with the CEO of Exercise Intelligence, Grace McNamara. Grace, welcome to the program.
Hello, good to see you, Brian.
I've previewed for my audience here a little bit of your biographical background, but nobody can tell their story like themselves. So, how did you become, or how did you come to be the CEO of the company that you are leading today, and what brought you down the road to that journey?
Yeah, well, long story, I suppose. But let me tell you the shortened version. I suppose I've been lucky enough that I've always been, athletic and been able to be active. And I'm kind of designed to move. I'm tall, athletic, fit, and I've always played sports. So always been in my life where exercise has been part of everything. And I suppose as you know, we all know, life throws you some curveballs, right, at times. And I've always found that activity has been helpful. And everyone around me, I suppose, I've seen as well use activity as part of their coping mechanism, their enjoyment for life. It's gotten through different situations and different conditions, and particularly health, right? And I'm lucky enough that when I started on my journey of physiology and fitness, a lot of time the focus was on health, and for health reasons. It wasn't just the fit getting fitter. And I've been lucky enough to kind of have a lot of experience of working with people with disabilities, people with conditions, people that are using physical activity for their mental health. And that's always been kind of the journey I've been on, which is quite enjoyable, actually. And ultimately, when I've spent a lot of time in technology. I was at Apple for 12 years, worked through technology and tried to help lots of companies use technology to deliver better healthcare. And I'm a big passionate person that does believe we have great healthcare clinicians across the world, but often technology or situations are hampering their ability to do their best work, and hence then people don't get the best healthcare. So I'm a big believer that technology can help reach people no matter where they are, and help people to share their story and share their actual data in a way that's healthy and that's positive and reinforcing themselves and the personalization. So Exercise Intelligence, the company that I'm running right now, is all around how do we help personalize healthcare and personalize activity for health in a way that it's complementary to healthcare solutions and pathways, regardless of the condition, regardless of the clinician, regardless of the part of the world that someone's in order to help somebody to be active, to see the health changes, health outcomes that they need and should see, and also share a lot of data at the same time with their clinician and with their trainer and with their support structure, right? How do we help activity be part of healthcare? How do we help activity be part of their normal? And we've had the exercise as medicine for years, but we've never put into practice. So that's what I'm all about here, is putting the research and the science into practice where it can be used and effectively for every person, regardless of where they're located and regardless of their health status.
So tell us a little bit about the formation of your company. What inspired you to take the route to actually go out and start your own business rather than partner with somebody who might have already been in that space, or was this a space that nobody was in?
When I was at Apple, I was doing a lot of work with a lot of companies, big and small, right? And I was working across different channels, whether it's pharma, insurance, and so on. And every single strategy I was working on, physical activity was part of the pillar, right? It was a pillar that was important. And as we look at longevity, same story. Exercise and activity is never going to change. It's never not going to be an important part of care. So when I was working with some startups in London, this idea was actually floated, and I was like, well, it makes total sense. We've had the science for decades, but I was like, well, why hasn't it been done? And this is pre-COVID, right? So it's pre-COVID. So the hamstring part there is clinicians didn't always trust technology, and understandably so. There's some good technologies out there and not so good technologies. So COVID shifted the landscape in relation to technology being an important part that can help reach people at home and where they're at. And so it became important that we could finally link the dots between the technology, the science, the seamless integration of consumer wearables, the seamless integration of the science, and bring it to the people at large, at scale, right? As opposed to just the individual one by one situation. So I ultimately met the co-founders of Exercise Intelligence, of EXI, in London when I was supporting accelerators and startups. But the biggest question we had to answer was, well, why hasn't it been done before? Like, what's changed, or what hasn't changed, or what hasn't happened? And part of that was the mindset. It was a big part of that was mindset. But also digital fitness, none of it, or very few solutions, are clinically and evidence-based, first of all, and go through the rigor that healthcare solutions go through. So the biggest difference where EXI sits is we have intentionally gone down the route of making sure that we are leveraging the science, but also clinically validation across like FDA, CE, UKCA, and beyond. Because we have to think of exercise as medicine in a way healthcare people think about technologies. And that's the biggest difference. And we're the only, it's really sad to say, but in 2023, we're the only platform that's FDA class 1 that is focused on exercise. And that's a really sad fact in one way, but it's obviously a big opportunity for us because we think we can do this and do it better. And the landscape today is like never before, partly because of the COVID and the shift in mindset there, but also partly because now we have the technology, we have the data, we trust encryption, we trust data private privacy, we trust AI a little bit more. Now we have more to go there, I think, in trusting the clinical use of AI. But we have all the pieces of this pie, so it's a time like never before. And I'm really excited that we can finally bring this to scale to the people who need it the most.
So let me ask, as you go through that approval process, it's fascinating that there isn't any other formally approved, I guess, application is what we can call it,
Mm-hmm.
that focuses on exercise. What was that approval process like? I mean, what are they looking for to have you prove the benefits of this when it feels like, I mean, exercise as a principle has been a long established
Right.
treatment option, but it's always been packaged with other things, which often include medication.
Right. And well, the biggest argument was we know it's safe. We've had the risk benefit analysis for exercise for everybody for decades. So they're like, we don't need to regulate you, right? Just go ahead, get people active, winner, winner. But that's the reason why we haven't had seen it done at scale, especially with clinicians, because they don't trust, what the program is, who's created it, is it evidence based, is it just made up on the spot? There's no validation. So what we have to do for it to be class 1, and I appreciate class 1 is not a high bar. It's definitely higher for sure, but it's proving that it's safe. It's proving that it is evidence based, that it is based upon the science that somebody else has proven independently, and we look at it from a few different angles. So when we have the exercise science, we literally have decades of exercise science. Every single person should be active. There's no exceptions, and every single person can be more active today. Slightly more active also is massively health enhancing, and in even small amounts of exercise, as we know, is health enhancing. So we know that we've had loads of research with it. Are digital therapeutics safe? Again, loads of research to show yes, they can be safe. We can apply technologies to help people at home and to be incentivized as well as to be engaged in their own health. That works. We know, look at behavioral change methodologies, and there's loads of them that again have been proven to work in different ways, different people. So we got to take what we know works and help intentionally make sure that is front and center? How do we engage people who are currently not engaged in their own health? And we work around incentives an awful lot. So how do we encourage, motivate, reward people? So more of the carrot mentality than the stick. And again, there's research behind all of this. So it's just bringing all of this research to say we're doing the strategic approach of everything that's already proven has been to work. We take the best of it, we layer it into a solution. Then for us to get accredited, we have to go through the process of proving that we're safe, proving that we're effective, proving that it's evidence-based, proving that we're looking at every single decision is data-driven, and then looking at the research of in the real world, is it working for people, and what are the consequences if somebody over exercises, if they overstretch, if they overtrain? How do we ensure that that doesn't happen? How do we ensure the safety features are in place for different conditions as well as different medications? And going back to your point there, Brian, around medications, we're not saying exercise or technology is going to be the solution. It is one pillar of a care pathway, and it always has been. It just hasn't been used all the time. So we want to make sure that exercise, regardless of whether you're on a medication, regardless of whether you're waiting for surgery, you're post-surgery, you have a condition that's, at risk, or yet you are diagnosed, exercise has always been best practice, always, no exceptions. But we've never deployed it. And this is what we want to change, is we want to make sure physical activity, personalized and safe, can be deployed for every single person who needs it, regardless of whether they are seeing a clinician, oncologist, cardiologist, or somewhere in between.
Now, if I understand the concept of the technology that your company offers correctly, you mentioned one pillar of it, which is personalized programs, and then the ability for you to offer incentives to stick to the goals of your program,
Mm-hmm.
and then having, and I presume this is a physician, monitor your progress. First of all, did I get that right?
Well, it doesn't need to be a physician, right? Ideally, it's
Okay.
great because it means accountability is a huge part then of somebody actually achieving what they want to achieve. Accountability is huge, but it doesn't have to be. The beauty of this being science-based and being exercise being safe, you can download the app and get going today yourself. If it's prescribed by your clinician, we see much higher uptake and much higher adherence long term. But also we work through employers, for example, self-insured employers, where it's a cultural support structure as opposed to your clinician.
Okay. So talk to us a little about the incentives. How does it work? And what is the science or maybe just the philosophy behind the incentivizing of sticking with your exercise programs?
Yeah, what's important to think first of all is we've had this stick approach in health for a long time and it hasn't worked, right? So we have to think differently. So we work first of all on more the carrot approach of what is your motivation? What's motivating for you? So intrinsic and extrinsic motivations are huge here. Some people, like, they really want to get active, they really want to lose weight, they really want to manage their diabetes because their incentive is something completely abstract, like, dancing at their kid's wedding or something. And that's like, that intrinsic motivation is key. That's super important first. So we got to find out what that is and then help somebody to acknowledge that and then to track back of, is it working? Are you still going towards that goal? And the extrinsic motivations, likewise, there's huge research around incentives and carrots work, right? And we just want to layer in as many of the technologies and methodologies that work here to bring people through a journey sustainably. So what we try to do actually when you onboard first is your first incentive, your first reward is like an Apple Watch, with the idea being it's a technology that helps you achieve more rewards on a monthly basis. And they're cash rewards right now, right? But so it's important that on a month by month and a week by week basis, you not only get the instant gratification, and you also get the physical cash reward of, well done, you're doing great, you're on the right journey. Because effort is what we have to reward, not necessarily achievement, because achievements may not happen too often, whereas effort is every day.
Now, when we think about exercise, one of the things I think is daunting for people is the idea that exercise means high intensity, going to a gym, taking an hour out of your day, full sprint on a treadmill.
Right.
I certainly don't think that is the philosophy that you've employed, but talk to us a little bit about what the exercises are, those daily things that this technology incentivizes that actually have a positive impact on health that maybe don't require the full 1 hour aerobics class.
Right. And it's amazing the perception we have of what activity means. And I bring it back to complete basics, that every movement counts, right? So the personalization of the program that XE deploys to each person is based upon frequency, intensity, and time. So it's a number of minutes in the number of days over the week in a certain heart rate zone. That's the right heart rate zone for you. The type of activity is irrelevant, right? Whether you like to walk outside in the fresh air, that's fantastic. Whether you like to swim, Zumba, karate, doesn't actually matter. The type of activity from a health perspective, as long as it doesn't matter, as long as you're happy and you enjoy it and it's accessible, that's the activity to choose. So the type of activity has less importance than getting up, getting active in whatever capacity that means. And it can be as low as like 10 minutes a day for 3 days a week, at low intensity heart rate zone. That could be the starting point. And that's the starting point for lots of people, especially if they're currently sedentary. So there's no point somebody having the perception of, I got to go to the gym, I got to do a spin class for an hour, and I got to somehow, sweat my ass off. That's not going to work. It's too aspirational for a lot of people. And that's great if that's your thing, but most people won't get there. 20% of the population at best is an active, fitness center, fitness club membership. And that's like 80% of the population will probably never go in the door, or it's not their thing. And that's fine. It doesn't actually matter what type of activity. The heart rate zone that you're in is where the health enhancing activities come in. So the heart rate data is one that we focus on, and hence we work with wearables. Now we look at lots of data. We give lots of people back their data from whether it's their gait analysis, whether blood pressure, their resting heart rate, their glucose stability, because all of them are very important, and that's important then inside the health enhancing story.
Does it matter with age? I know certainly the younger you are, the easier a lot of these goals may seem to meet. As you get to be more senior and you maybe have other health conditions and issues, it becomes a bit more challenging. How important is it that you tailor it for the age and the general health of the person who's using the tool?
Yeah, we take in a number of factors in order to personalize the program to the best of the science today. So that includes your age, your gender, your activity levels today, whether you're on beta blockers, what your conditions are, what your symptoms are, and how well managed they are. And so we look at all of those factors in order to personalize the program literally to the best of the science today. And there's lots of different factors in there, and lots of guidelines that have been published by the WHO, the ACSM, or the organization bodies that we take into consideration, because it is important. It's going back to what is your age, what is your activity levels today, what is your symptoms. They're all important in their individual way, which is part of the reason why this hasn't been done well before, because there's so many contraindications and it's so complex, because most people have more than one condition. Most people have more than one risk factor. Most people are nervous or not confident about their ability to achieve activity and health and whatever they're looking for long term. So we got to factor in all of that. And actually, the exercise science is probably the easy part, but it's the intentional behavior change methodologies are the hardest part, because we can all start getting active, but typically you start, you don't sustain it, and it's something got to do with your lifestyle. It's more of your behaviors throughout the days that is one that's blocking you. So we've got to figure out the barriers as well. So it's all
What are
important.
So I'm going to imagine that one of those bigger barriers, just from anecdotes of people in my life, is the pulls of family pressure. You've got 2, 3 kids at home. You've got maybe an aging parent that you're taking care of, and so much is devoted to that. Is that one of the things that you're finding can be a distractor, so to speak, from your intentionality, or are there other routine things in everybody's life that are getting people off track?
Yeah, I think there's routine things in everyone's life that we all have barriers, right? We all have very busy lives. I don't know anybody who hasn't got a busy life, to be honest. And actually, the people that are the busiest will find the time. But one of the beauties as well is the reason why we think wearables are a key important factor here is it's all day movement, right? So the heart rate zone we're looking for you to be in, it doesn't mean you have to get to the gym. It might even be your standard activities that you're doing, cleaning, gardening, laundry, all that good stuff. That all counts. So when we are able to look at your heart rate zones throughout the day, every minute can count. And that's an important factor. So in one way, it allows us to reward people that have got busy lives and are consistently moving and doing, that they might actually be hitting some of those minutes. And it can be reassuring to know it's part of my daily activities, my daily life, and they can be captured because I have the technology to do so. And hence I can get rewarded for being active in the right zone. And it helps confidence wise. It helps people to see I am actually active throughout my day, but I've never had something to tell me that before. But I do find that the barriers that we put in place are they're never going to stop unless we decide that our health is important. So we do need to look at it. What is intrinsic? What's the motivation for me? What do I want to achieve? And then we got to put lifestyle habits behind it.
So you mentioned earlier when you were working in your previous life that you interacted with pharma companies, with health insurers in the United States and elsewhere, with governments, I assume, as they were trying to reduce the cost of healthcare for their populations. Where does this fit in that continuum of our healthcare system? Let's focus on the U.S. and Canada and the U.K. for now, for the benefit of simplicity.
Hmm.
Is it something that you foresee health insurers and employers and governments would be more likely to promote? Is it something that you think the pharmaceutical industry would partner with you on? Uh, where does this kind of medication, we'll call it treatment, fit in the continuum of what our healthcare system in the West, at least, is set up to do?
Yeah, and we're in a unique time, obviously, as well, right now, with the anti-obesity medications coming to light and like some of the effects and the positive effects that they're showing as well. So exercise sits alongside it. And for the first time ever, we have a medication for obesity that's saying you need to be active alongside this medication. And that's a phenomenally, important aspect here. And it's the first time ever. So we need to acknowledge that we're in a changing time here. It's important that exercise sits alongside, and it always has for best practice, alongside any other treatment, right? Whether it's surgical or whether it's medication or whether it's on another alternative. It's never not been best practice. So exercise, and what we look at is, yes, we're looking at self-insured employers right now. The evidence has shown that if somebody is active and they change their health, obviously they cost less. So the health self-insured employers are saving and cost avoiding a lot of cost there, whether it's bariatric surgery and so on. And I know the medications can be expensive, but reality is if we're able to help weed and reward people who are willing to change their lifestyle, willing to change their lifestyle in order to sustainably change their health and to sustainably keep their health in a positive way, then we're in a much stronger situation, and we're able to do that. That's something that we do quite differently. So to your point of who's going to pay for this, we know that exercise costs less than most of the treatments. We know that exercise works alongside of the treatments. We know that exercise sustainably maintains health and maintains the cost avoided that somebody is hitting. So do we see exercise being able to be funded by a government, by an insurer, by an employer, and so on? Yes. I know the Physical Activity Alliance right now in the US is doing phenomenal work around lobbying for more of those payment plans and CPT codes and so on. And it's been amazing that we don't have CPT codes for exercise, to be honest with you, directly. I know there's remote monitoring and so on. But it's important that we're going towards an era that has governments and other organization bodies being very clear on we should be funding activity more. And we should be funding activity, especially people that need it, and it works for health enhancing reasons. And it's a much cheaper, much higher return investment than the vast majority of other solutions out there. And I think it's important just to note, obviously exercise sits alongside like nutrition and diet changes. We're not saying do one or the other. They go hand in hand together. And so exercise goes hand in hand literally with every other part of healthcare. There's nothing where it doesn't complement. And that's the beauty of it. And that's the shocking part, Brian, when we still look at like we're the only technology solution that's physical activity first and driven in a way that's for health and health outcomes for people that need it the most.
Yeah, and I'll just pause for a moment on that CPT code. I know outside the U.S. that doesn't resonate. It is a bizarre system in the U.S. all of our billing is based, all of our billing is based off these magical codes that are tied to certain treatments, and if you have one, it can be billed against, and if you don't, it can't. And so we can go into a whole nother program about why that system exists in the
Yeah.
U.S. But for those who
Different
might have missed
podcast.
it, yeah, a whole different podcast indeed. Are there specific treatments, are there specific disorders or diseases or conditions that are particularly tailor made for exercise and we'll call them personalized programs? Because there's every condition in the world, one could argue, would be helped by this, but I
Mhm.
assume there are some that have better responses faster than others. And I'm curious what the research says on this.
Yeah, pretty much every condition, especially every chronic condition, have guidelines around exercise. And so, yes, there's obesity, cardiovascular disease, cancers, diabetes, you name it. There's guidelines for each and every one of them. And the hard part about that is there's contraindications and there's cautions around each and every one of them. So that's the reason why it's important that we put this in a technology in order to personalize this, just taking into consideration all of those factors for each and every single person. But you're right. Is there certain conditions that work better? Yes and no. It depends on the person, and every person's different. So if we categorize people by their condition, we're going to miss out on whether they're actually active. Are they managing the condition? Do they have symptoms? Are they on medications? Where in that journey are they on? So it's important that we not only look at the science and say, here's the best personalized exercise for you today, but actually it needs to be adaptive on a week by week and a day by day basis. is it too easy? Is it too hard? Is your symptoms flared up or not flared up? Is it helping you manage your side effects of the medication or not? So we actually interact an awful lot in order to better personalize and adapt the program on an ongoing basis with each and every person, because it's too easy to think about someone as part of their condition. And that's where I think and I'm a big believer, is it's people first, right? It's a person with a condition, it's a person with a disability, it's a person with multiple factors. So we got to go into the personalization. We don't consider all of the science, but at the same time, the person that's right in front of us, we're going to miss out an opportunity, and we're not going to meet people where they're at, and hence it's not going to be sustainable long term.
Do you find that the behavioral change is the easier or the harder part of this? And I say this because I don't know if it's harder to get people to get that first intentional workout in, and then it builds momentum, or is it harder to sustain the momentum once it's built? What is the bigger barrier for people to make the long-term change?
Yeah, and there's a numerous factors here. Again, it goes back to that motivation, right? What's their intrinsic motivations versus what's their what their barriers are. It's important that we set up as many behavior change and engagement tools as we can, because what's going to work for you, Brian, might not work for me, right? And what might work for you today might not work for you in 6 weeks' time. So the behavior change is important, that we look at how do we engage the most people right today, and how do we continue to engage them, literally continue to engage them day by day, week on week, in a sustainable way. And you're right, it's really hard. The exercise science piece is much easier because we have science, decades of it. We haven't got as much behavior change science, and we haven't got as much personalization around behavior change. So yeah, so we do a phenomenal level of work of how do we continue to engage you today. And look, I said incentives and rewards are a significant part of that for us, but it's around how do we make sure that you feel like you're taken care of, and you have got the best program for you, and you're in a safe place that's helping you build your confidence, build up your routines, and build up your support structure around you. And it starts off on a low basis. We got to meet people where they're at, and then we got to incrementally increase over time to get people up to the guidelines of 150 minutes of moderate intensity on a weekly basis sustainably. It's not easy, and that's why it's important that we continue to engage and adapt. And we'll go through phases, we all do. Christmas is around the corner, where people may not be as active in certain weeks as they are in other weeks. And that's okay. That's absolutely fine. And I do hate the term of falling off the wagon, but we hear it all the time. Life's a journey. You're going to have good weeks and bad weeks, and good days and bad days. That's okay. You just got to get next day, tomorrow, start again, or today, start again.
So I can't imagine that there's anybody who's opposed to the idea of introducing more disciplined exercise into healthcare. But what barriers have you faced as you've tried to bring your company and your technology more deeply into the healthcare system, both in the UK and the US, and anywhere else you've been exploring?
Yeah, well, the biggest challenge we get in healthcare, like the UK is a good example because we're in the NHS across multiple different programs. But the challenge that clinicians have, and I can completely understand it, is they've been talking about recommending or referring exercise for decades. Like they've said to thousands of patients, you should be more active, and it hasn't worked. So it's hard for them to understand that if I do something a little bit more intentional and technology driven, and I don't have to guide it, is it going to be effective? So it's kind of like this chicken and egg. We know exercise works when people adhere to it, but how do you get people to adhere to it? Technology, they may or may not be a technology person, they may not think that it's effective, but they consistently have the barrier of, not only do I not see it working in the past, but also, where if I'm not active myself and I don't understand the program and the science and the complexities, am I the right person to be prescribing it and to be referring people to it? And I get it as well. Then clinicians haven't got time, right? They're not only so they haven't got the knowledge, they haven't got the time, and I've got the confidence, and they haven't got the experience that it works. So we got to take all of those things ultimately off their table, I'd say. So the beauty of this and the ability for it to scale is for it to be automated. If it's enough that you've got enough data in your system as a clinician to say this person is inactive, that should be enough. Then we can help personalize and bring the science to life then. But reality is clinicians don't have time, and we get it. They don't have time or necessarily the knowledge or the confidence themselves because they're not active. And they might feel like a hypocrite when they're referring people to exercise if they're not active themselves, which is difficult because they're also overworked. So we see that a
Yeah.
lot. And that's one of the reasons why in the US, we're looking at how do we complement the clinicians that do want to refer and recommend patients be more active, but also how do we get to people outside of the clinical office, because that's an important factor. Hence, self-insured employers is a really good avenue, because employers obviously benefit They want to engage their talent. They want to keep their talent, and hence health is a huge part of somebody that's going to choose their employer for a long time.
Yeah. I mean, it seems like there's a little bit of a gap, right? So you have physicians who are focused on treating the condition that they can see, and let's face it, in the US, that they can bill.
Yeah.
And then, you have sort of the referral model of, well, you should get more active. Here's a referral to your local gym. Here's a referral to, a personal trainer or something like that. And that might be too much. And then here in the US, at least, our health clubs, they're incentivized to get you to sign up for a membership, which means coming in and signing up for all kinds of programs that may or may not be right for you.
Yeah.
Well, it seems like we're missing something in the middle that connects both the personalized care that you need with the right setting, which may or may not be a health club. It might just be something in your life. So do you think it's important that aside from the application itself that somebody get into, that you actually have the option to have a consultant, that maybe you pay a premium or something and you can reach out to an individual who will literally help customize that program for you? But it's not just the machine doing it, it's a person. Or does that already exist?
Yeah, and we work in a B2B way. So we try to look at it from the angle of we complement that professional, right? And there's lots of solutions out there that are helping you, try to navigate you into what you need. I think that there's a huge gap between healthcare and physical activity industry today, and I think that's where we're hoping to help kind of close the gap, be the bridge between the two, and help navigate to navigate you to what you need and who you need. We all have access to lots of professionals, personal trainers, as well as clinicians and coaches and dietitians and so on. We don't use them. Partly because we can't afford them, partly because we don't understand their value, partly because we don't know whether we actually need them and we're a right fit for them. So we got to join the dots between them. And I don't think there's one solution that's going to work for every single person. But we need to that's the beauty of the exercise pieces. Everybody can be active today. And then we can help kind of navigate and help kind of sort you into those buckets and encourage you to do it. And we're definitely finding more of that, where we're going to help people more around what do you need today? What's the other professionals that are going to be complementary to your journey? And yeah, we're all trying to get people in the right direction. Have we solved? No. Do we think that there's going to be a continued gap of people knowing where to go, what to do for a while? Absolutely. Do we need to kind of work through and work with the different parts of the industry, whether they're benefit providers, whether it's pharmacy providers, whether it's other insurers and so on? Yeah, we all got to work together. And that's one of the big thing, Brian. There's no one solution here that's going to solve the problem. We have to work together. We have the providers of healthcare and health, regardless of what the solution is. We need to work together. We need to integrate our systems. We need to streamline our solutions and personalization. And we need to make sure that we're thinking of every single person, not just those that can afford significant healthcare and afford a lot of professional help.
Yeah, it feels like the incentives in the system are not aligned to do all of that today, right?
Right,
And the incentives are for people to stay in their silos and treat the thing that only they know how to treat and they know how to bill for, they know how to get a subscriber for.
right.
Um, are there countries around the world outside the US, the UK, North America that you feel like are doing this well, either as part of their society, part of their culture, or that maybe there is something that's more centralized in the way they provide healthcare?
I think Singapore has done a great job. Singapore have got a nice system where they incentivize, and it's government funded, but they incentivize people to be active, right? And then they look at the data, they incentivize people to be active and share their data and share their health outcomes. And that helps then navigate people to services and solutions. So actually, Singapore's model is quite nice. And you're right, there's other governments around the world that we're talking to and that I've seen are very much engaged in how do we do this at a population level. The Middle East right now is red hot with governments trying to figure out is how do they incentivize their population to be active and healthy. And especially when a lot of the Middle Eastern countries, Saudi Arabia in particular, and UAE, they're and the UAE are just finished up their active month, which has been phenomenal. Like they know they have very high rates of obesity and diabetes, and unfortunately, their trends are worse than most parts of the world. So the governments are very active right now, hot and spending lots of money on how do we get our population to think preventative care as well as reversing the conditions that are already diagnosed for over 40% of the population, obesity and diabetes being the two big ones. So I'm definitely seeing it, and it's a really nice time in one way where governments are saying we haven't invested in preventative care before, and look at the trends we have. Every trend is going the wrong direction. So let's try to flip it on its head, because we know it's a better way of funding healthcare. We can turn a sick system into an actual health system, and instead of reverse the conditions and reverse the costs that we're facing into for all these conditions already.
So I have a fair number of more entrepreneurial listeners to the program. A part of the reason we do the show is to talk about trends like this, which is emerging fields of healthcare. But we have lots of folks who are in the middle or the beginnings of their journey to starting their own companies, and obviously you've done that with this. I am curious for you as a professional who took the leap to go into your own business and to start your own company. What were some of the barriers that you faced in just taking your idea and making it a business and getting a good team around you, and maybe some counsel or advice for those out there thinking along the similar lines?
Yeah, it's hard. I mean, and I was lucky in one way that the co-founders of Exy actually brought me in very early, but they had done some of the hard yards of getting the first two investors. But look, if it was easy, everyone would do it. So yeah, you got to surround yourself with good people who are really smart, intelligent, and going to challenge you, because you're going to end up pivoting 10 times. So you need people that you're able to challenge and respectfully prove, with data, why you should go down one path. And if it's the wrong path, be willing to acknowledge you made a wrong decision. Let's go down a different path. So it's not easy. It's not easy. You have to have good people around you, and every success you're going to achieve is going to be because of a team effort. So you've got to just be conscious of building your network, and network is everything. Because some people are in your network as on your team, you will not pay to be on your team, right? They're going to have to be supporters and ambassadors from the sidelines just because they agree with what you're trying to achieve. So share what you're trying to achieve, and obviously in healthcare we have so many people, millions of people, billions of people who need better healthcare and better access to what the science and what the evidence would say in the real world. So if you can find the people that are passionate and willing to dedicate their time and help connect you to people that you need in the journey, then you're on a winner. So network, 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 and it's not easy. So perseverance, and you need a team of people to go with you on the journey.
And certainly your hours change. You may be needed at all times of the day or night, so I'm sure that has an effect for your health as well. I'm curious how you adapted as you got into that sort of environment with so many different and unique pulls at you in a CEO role, especially. How have you adapted your personal exercise routine for your new lifestyle?
Yeah, I'm lucky. I still love my sports, and I still play my team sports, which is good. You got to just find a fit, and I like the term work life fit, where you just make it fit together, and you got to own your schedule. So you got to find your activity that works for you, and you got to go with it. And it might not be long term. I mean, I'm currently speaking today to you from Boston. As most of my team are in London. So do I work the London time shift as well as the US one? Yes, I do. Do I squeeze in my run in the middle of the day? Yes, I kind of do it after my team in the UK is clocked off and the end of my US day. You just got to find the time that works, right? And it may not be the same this month as it is next month. And that's it. Just find a routine if you can do. If you can't, great, fine. Just make it work in whatever way. Because reality is, especially in a startup, you're never going to have the same week. It's twice. You're just not. Your schedules are going to be all over the place, especially if we're dealing with international business, international people, which is the world that we all live in. Nobody's on the same time zone. So it's important that you literally just find the fit, and don't beat yourself up on whether it's 8 a.m. today and it's 4 p.m. tomorrow. Um, just fit it in.
Does the research tell us anything about time of day? Like I've known people who do like the midnight workout, which I'm fascinated by because I don't know how you work out and then go to sleep after that. But and then there's other people who insist on the 5 a.m. workout. Is there any research behind one actually having more benefits than the other?
Yeah, the circadian rhythm is definitely lots of research around it. I'm not sure everyone understands their circadian rhythm and what works for them. And I'm just a big believer right now is the vast majority of people don't have their own circadian rhythms. They're not sleeping when they think their body wants them to sleep, or they're not active when it's work for them. And partly part of that reason is life is busy. So look, there's lots of research that works that yes, you should work at a certain time based upon your body type. I'm not sure most people know it or adhere to it, and I'm kind of less worried about finding the exact right time for you, as opposed to find what works in your schedule, because that's the biggest barrier. If people work out at 12 p.m. and they find it's great for them, great. again, I don't care in one way from what type of activity you do versus time, as long as it works for you and sustainable. That's the biggest key here. It's not a case of I'm going to work out at this time because it's the right thing for my body. If it doesn't work for your schedule, you're not going to do it sustainably. So you've got to work it into wherever works, whether it's a 9 a.m. after you drop the kids to school, or whether it's a 9 p.m. because the kids are gone to sleep, or whether it's I'm on a different time zone. I'm working with Australia, and hence I'm up later, so I'm going to work out early today. It's whatever works. As long as you get it into your schedule, that works. Because if you don't, it's irrelevant what your circadian rhythms want you to do.
And getting back to the entrepreneurial journey, what was the point in your career where you started to feel like you needed to go into business, with a group of people towards a mission for yourself? Because you had a great career prior to running this company, but at some point you obviously had to make that mental shift that you needed to break out from the normal, you know, have a job, work for a boss, work for a big company, just keep doing your thing. At what moment would that for you? And was there a particular trigger where you decided like I know I have to do this?
Yeah, I've been lucky that most of my roles, even though they've been in large corporate like Apple, were actually entrepreneurial roles where I was setting up departments and setting up strategies and programs and so on. So I've always been that let's start it from scratch type of person. And COVID changed everything, in my opinion, in healthcare. Because technology was able to be a default, it helped. We had finally had the kind of the last piece of the pie for exercise. We had already had the science, we already had the wearables, we already had the data, we already had the sensors, we already had the ability of behavior change and methodologies that work, but we didn't have the mindset. And when that changed, it was when I was asked to come over full time to sort of set this up and to bring it to a business and to make it scalable. And it's like, yeah, I think we finally have all the pieces of the pie for this to work. It never worked before, and I don't think without COVID it would have worked, to be honest with you. But now we have an absolutely phenomenal different landscape. And now that we have the GLP-1s and the anti-obesity medications, it's a phenomenal shift in the right direction again, which is super exciting. So I think all of these pieces of the landscape changing have been very, very important aspects. I love starting stuff from scratch because I love the idea of we can do better. And I think everything that we look at, I look around me and there's processes and there's things that work great, but I look at everything and say, what can we do better? And then I'm always looking at people and going, how do we do this together? We can absolutely improve some part of healthcare. We can improve some part of people's lives. So let's do it. Let's get on with it because people deserve it.
And what do you think about the alternative? I don't even know if you want to call them medicines, but things like meditation, things like I guess yoga would be considered an exercise,
Mhm.
but maybe not everybody puts them in that exercise bucket. These are just intentional things that you do throughout the day to manage your stress, or maybe you take a 15-minute yoga break or something of that nature, or maybe you just stretch. It's not even a real workout. Do you see those as complementary to
Yeah,
the exercise regimens that you'd otherwise have,
yeah.
and that they're as important, or do you feel like those are nice to haves, but maybe the research isn't there to support their role in your health?
Yeah, I don't know the research as much around the meditation space, but I do know everyone that I do know work that meditation is it works really, really well for their stress levels, for their hormone levels, and so on. So, I'm a big believer everything complements each other. We know they work. So, our health in their physical body and our mental body, they're not separate, right? Our physical health and mental health are all tied together. So, if somebody works through meditation and that works for them, fantastic. Absolutely fantastic. Will it help manage their chronic conditions and their blood pressure, for example? Absolutely. It all complements each other. And that's one of the beauties here is that we're not saying activity needs to replace something else. If you have the time and the schedule to have meditation, to be active, to eat better, it all works hand in hand and complements each other. And actually, what we do find, what is the research, Brian, is around if somebody is conscious of one of their lifestyle behaviors, they're more likely to be conscious of others. So if we focus on just activity, for example, people that are physically active typically choose better food choices, right? They're aware of kind of the calories. They're also aware of the benefits and the consequences. And likewise with meditation as well. They also better at going to their health screenings, to taking their medications on time. So it has a multiple knock-on effect. So you focus on one lifestyle behavior, and people naturally will have positive impact on all of their other lifestyles, types of behaviors.
What does the research tell us about the role sleep plays in all of this? I know people who actually sacrifice sleep to get their workout in, and they insist that that is the right exchange for them, and they might be right. But I'm curious if you all looked at that, or if that's even been studied about if one has to make the trade off, is that a trade off worth making, or should you just get yourself to sleep?
I'm a big believer in sleep, and our bodies, give or take, require 6 to 8 hours. I don't think people, someone should compromise their sleep for an activity. I've done it myself loads of times, but it's fine on an ad hoc basis. But over a consistently period of time, sleep is important. We know it's an important part of your body's regulation. So if you're not sleeping and yet you're working out loads, you're probably still going to have some issues there. And I would recommend balancing that out. Your body needs at least 6 hours. We know that. The vast majority of science around sleep has been very clear. Our bodies need sleep. Our bodies need that recovery. Our bodies need to recuperate. And a lot happens when you're asleep. So my opinion is you need to get looking at least 6 hours, fit in your workout. If it needs to be that you're compromising sleep first, don't do it on a long-term basis. You can make it short-term and get back to a routine where you're getting sufficient sleep and you're fitting your exercise in somewhere else.
It's a funny thing, as so many of the entrepreneurs I've talked to, including some who I've brought on this program, take great pride in getting like the 4 hours of sleep or the 3 hours of sleep, and they wear it as a badge of honor. And I always think that that seems unsustainable. There's a certain point where you're just going to hit the wall.
Yeah, it's not sustainable, and your body's not going to thank you for it later. And I don't believe that can only get 4 hours of sleep. I do believe that's a choice, and we have this badge of honor sometimes of pretending that we're ridiculously busy and hence we're ridiculously important. We're not, right? None of us are that important, and none of us are that busy. If your body needs at least 6 hours, get it. Yeah, that extra 2 hours is not going to make or break your day. It possibly will make your day better because you're going to be more efficient and more focused. So you're compromising 2 hours of sleep for possibly 2 hours of quality. So I'm a big believer, get some sleep. It's not worth it. If your body requires 8 hours, get the 8 hours, and hence your daily more effective. So it's about quality, not quantity, in terms of the rest of the day. Then.
All right, everybody who's listening, you heard it from a living, breathing entrepreneur running their own company. This isn't just your family lecturing you here. This is real from coming from one of your peers. All right, let's talk about the business of Xe. So you mentioned that this is something that has a level of regulatory approval. Now, can any individual go on an app store and go download this and try it out for themselves, or do you have to do this through a formal program with your employer or doctor or something?
You can go on the App Store today, download it, and get going. Best case scenario is you have a support structure around you, which is why we focus on the B2B model, where it's through your employer or through your healthcare practitioner. But you can absolutely go on the App Store today, download the program, and get going on a personalized program today.
And this is available on the Apple App Store. Can folks get this on what would it be? Google Play would be the Android version.
Yeah, all of the above. No matter,
Okay,
regardless of your
excellent.
phone, you can get access to the app.
Excellent. And if people want to learn more about the company or learn more about you, where would be the best place for them to find more information?
Yeah, look up xe.life. The website has a lot of details in there. It shares a lot of some of the science high level as well. So yeah, xe.life is the place to go. You'll see lots of programs. You'll see how we work, who we work with, and some of the solution.
Excellent. And we'll get the link to that as well as the app in the description of this podcast. Grace McNamara, thank you so much for taking some time to speak with our audience today.
Well, thank you, Brian.
I certainly hope that you enjoyed that conversation, listening to it as much as I did conducting it. Grace is uh, a real inspiration for so many reasons. Number one, somebody who was bold enough to take an idea and turn it into a successful business and stick to it and manage her own stress and her own health care through that entire process. I also think it's just wonderful to see people whose ideas are motivated by helping others. And I think you heard in Grace's voice and in her passion for her product, she really is somebody who wants to help, who sees so many people in need of meaningful healthcare interventions. And there's just not much that the traditional medical system can offer them, but something as simple and inexpensive as a simple app with some incentives and some tailoring just for you could make a huge difference. So much so that it may extend your life, or it certainly may make the quality of your life better. So, if you'd like to learn more about Grace, we've included links to her website, a link to the app in the App Store, as well as Google Play. And I think we've included links to her social media channels, any of her web assets. She's a fascinating person. It's a great company. And at the minimum, I encourage you all to take some time to learn a little bit more about it. All those links are in the description of this podcast. And you can also go to my website, brianjmatos.com. We've got show notes up for this program. You can go there, find those links, read more about the conversation that we had. Copy and paste some of the key takeaways from the program so you have those for yourself. Um, and of course, you can find our whole library of programs. And we've done a great series of interviews now with a wide range of experts so that this community of curious minds can get all kinds of questions answered about the big topics and trends in our world today. So, in the spirit of that, I'm looking forward to our next episode with Louisa Ha. Now, we have talked with experts in the media space before, but what we really didn't get into specifically was the place that we're going in the future with this loss of trust in traditional channels. If you consider traditional channels to be traditional media companies, the big networks in Europe and the United States, where people used to sit down for a half hour and watch the evening newscast and trust that most of what they were getting there was accurate and fair and balanced, and then they would go on with their life and make decisions, about their opinions based off of that, or when newspapers were a bigger part of our lives. These were the trusted channels. And now, so many of this, the media landscape has fragmented into mini corners where people don't share common sources of information and where there is content moderation happening in one way on one platform and a different way on a different platform. People getting their news from social media as opposed to traditional media, all different forms of social media. And influencers and the role that influencers play, and what is an influencer? And what about the next big changes that are still to come? What about where media is going? What the role of local news in smaller communities, and the changing perception of what it is to consume media. uh, we get into a lot of those specifics. Now, in previous episodes, we've talked about the business element of that. We get into a little of that here, but this was really about media consumption. How are people choosing to consume media in general? Entertainment as well as news, hard news, political news, policy news. Where are they getting those? What are the business models that are trying to meet that need? And then what was fascinating to me in talking to Louisa as well was all the things I hadn't considered about how influencers play such a critical role at different age groups. So younger people maybe take more influencers at face value. People who are looking at the same influencer, but they're 20 years older, they perceive it in a different way, the same piece of information. So it's a great conversation. It's a departure from our healthcare topic back to a little bit of media. But I think it's really important that we talk about this because how we consume media, including the fact that you're all listening to me now through a podcast, which wouldn't have been possible 25 years ago, and the fact that we can have this conversation and you have easy access to it, which wouldn't have happened in the past. And even how the role of advertisers shapes what is consumed, what is promoted, and what is available for people to consume. All of these are hugely important trends. I don't care if you run a business, you run a church, you're running local government, you're running a nonprofit. You need to understand how information is getting out to people because these are the channels of communication which are critical to getting your message out, whatever your message is. And whoever is able to communicate most effectively, not necessarily loudest, but most effectively, is going to shape public opinion, public policy, and potentially shape the future of where investments go, dollars go, interests go. So I think it's a topic worthy of our time. This is a community of curious minds, and I invite you to join it. If you haven't already visited my website, brianjmatos.com, I encourage you to do so. If you are not a subscriber, if you're only listening to this show for the first time, or maybe you got a clip on YouTube somebody had sent you and you got to this program, I encourage you to go to anywhere, any site that you get your podcasts and get yourself subscribed. You'll be the first to see all of our episodes when they post. So whether that's on Spotify, on Apple Podcasts, on iHeartRadio, on Amazon Music, Player FM, the Libsyn app, or the Libsyn website, you can get access to all of our programs on all those platforms and pretty much anywhere else that podcasts are available. So if you subscribe, even if you don't listen for a couple of weeks because you're busy, we'll be there. We'll be in your feed. You can easily find us anytime, anywhere using apps that you're already using today to listen to other podcasts or music or any other audio of your choice. My website homepage has 4 of the most popular podcast channels, so you can get a direct link from there. You could do this on your mobile phone. You could do this on your laptop at home at night. But either way, you can go to my website, get those links, get subscribed. And if all else fails, go to your favorite podcast aggregator, just search Brian J. Matos Podcast, and you will find us. I am available on all the social media channels. You can find me at Brian J. Matos on X. You can find me on YouTube. We post clips of the program there. Just search Brian J. Matos or Brian J. Matos Podcast. And we are also available on Facebook. We post occasionally on Instagram. And we are available pretty much on any social media platform that you choose. Thank you all again for listening to this program. Look forward to speaking with you again on the next episode. And until then, I invite you all and encourage you all to stay curious.